I think it's just very important that parents really understand the impact of their child's concussion. I've seen a number of families in my office that although their child is their number one priority, the bigger picture is they want the scholarship, they want the child to do the best, they want the child to be that trophy child. And I think that parents need to understand that whenever there's an issue, no matter how small it is, that the parents, if there's two parents, to come together on the benefit of that child to say, we need to stand our ground and say absolutely no return to play until we're comfortable that he or she has returned to somewhat normal baseline. And I don't see that enough out there. I see parents arguing with one another. I see a lot of dads saying it's okay for him to return. I know it's okay to return. I would have returned if this were me. And I think that the kids who are coming out now are more apt to say, wait a minute, because of the concussion laws and what we're teaching. So if I can impress upon anything, it's to know your child and it's to really be aware, and if they need to be pulled, it's okay to be pulled.
Where the parents have to divulge if the child has had a concussion before. Is there a lot of information available for the parents? Because a lot of people don't realize that a simple headache can be a result of a concussion.
Well, that's an excellent point, and that's why we're pairing that with the training piece. So ideally, people have been trained to understand what a concussion can really look like. But the way the questions are asked are really, has the child ever had a head injury? Have they ever had these kind of symptoms? And if so, when did that happen and how long did it last? So we're trying to get at that until everyone really understands what a concussion is. But we feel like that's important information for the coaches and the athletic staff to have, so they know who they need to look out for.
Can't the trainer or coach overrule the parent?
They can overrule the parent to a degree, but when you're talking about children, you can team shop. This can follow you. If you're in a more structured sport, absolutely, then the trainer can follow. But there are parents who will team shop until they get the answer that they want, and they'll pull their child from a school.
So you think not just coaches and trainers, but maybe all pediatricians should be trained in concussion awareness?
Absolutely. Absolutely. I think it's critical. We're going to see more and more. And with the concussion law, these children will have to have a go-to to return to sports. So somebody's going to have to answer these questions.
There's a lot that parents should do, and most of it they're not doing. And one of our goals is to really turn parents into advocates for their own kids. They're advocates for them in so many things, but they really don't pay attention when it comes to sports and the environment that coaches create. Now we know, and I'm a firm believer that coaches are out there because they care about the kids, they want them to succeed, but they also don't like people telling them what to do, they don't like restrictions, and because they're mostly volunteers, they don't have the time to invest to learn this information. So what parents should be paying attention to is, it's a long list. Are their coaches educated on concussions? At a minimum, are they doing the CDC's online certification, which is 30 minutes and free? If they're not, you shouldn't be sending your kid there because there's no reason they shouldn't be doing that. There are larger ways to teach and to educate. We provide a lot of that through Sports Legacy Institute, but at a minimum, the free online stuff. Is there a preseason meeting for the athletes and the parents so that they understand what's going on? Especially now. Maybe we won't need it in 10 years because everyone will get it by then, but now no one gets it. We're always walking into cold rooms where no one, I gave a talk to 500 coaches in Chicago, and I said, okay, how many coaches here have had first aid training? Everyone's hand went up. How many coaches here have had CPR training? Everyone's hand went up. How many coaches here have had concussion training at any point in their career? 3 hands went up out of 500. Like, let's wake up here. So, starts with education. That needs to happen. Then, you have to look at your program's policies. All the guidelines now say, and it's now state laws in over 30 states, no return to play same day of a suspected concussion, required medical clearance to go back. Does your league require that? Most laws don't actually touch the youngest kids. So if you have a 7-year-old out there playing a collision sport, you better be sure they have those policies in place and they're educated enough to use them. Does the program commit to a reduction of repetitive brain trauma? Because we're realizing now that concussions aren't the only problem. Every hit to the head may be damaging, and what we're certain of is every hit after concussion is really damaging. And if we're only diagnosing 10% of concussions, we should not be opening the door to 90% of those kids taking another 100 hits to the head every week. And so, are the coaches hitting a lot in practice? Are your soccer coaches paying attention at all to how many times kids are heading the ball in practice? We have pitch counts in youth baseball to protect athletes' elbows, and we never ask a soccer coach or football coach to even consider counting how often they hit your child in the head. So that should be a question parents ask. They should be looking at the equipment. Are they using newer helmets? Have they been reconditioned? That's part of it. It's lower down the list, but that's still part of it. And there's more, but I would say at a minimum, if your coaches have not been certified and educated by the CDC, don't sign up your kids, because they could end up being one of those kids in our brain bank.
This excerpt is brought to you by the Massachusetts School of Law, the leader of reform in legal education and a leader in multimedia education for the public. To view the full interview and for a full listing of MSL's programs, log on to mslaw.edu.